Hi everyone, thanks for coming. Welcome on behalf of Scott Goldstein. Welcome to Pikesville. My name is Sean Barinholtz. I'm an anesthesiologist, critical care physician at Hopkins. I'm a member here at Pikesville, and I'm CAR 609 in the medical director's office. On behalf of all the medical directors and certainly Director Shenning as well, thanks so much for participating. A specific shout out to Roz Berkowitz, who has brought a number of topics and today brings us yet another amazing speaker. So thank you for that. And today we have Ashley McAree. So Andrea's talk on adult abuse and neglect, we rescheduled till, we'll get the next schedule out. It's just too much content for one night. We would have been here way too late. So we divided this up into two talks. So tonight is Ashley. Ashley is an amazing forensic nurse employed with GBM Safe Program. She's certified as an adolescent and adult and pediatric forensic nurse through the Maryland Board of Nursing and obtained national certification from the International Association of Forensic Nurses. She's an active member of Maryland Child Abuse Medical Professionals Program and the Baltimore County Sexual Assault Response Team. She recently Human Trafficking Work Group. Human trafficking education has become her passion. She's developed many trainings on the subject, and she has taught about this topic extensively. Her goal is to further educate professionals who may come into contact with victims, children, teens, adults, young adults, parents, and community members to recognize signs of human trafficking in order to assist current victims and help spread awareness in hopes to prevent this crime from ever occurring. So Ashley, thank you so much for being so generous with your time.
Thank you very much.
Great.
Okay, hello, good evening everyone. Thank you so much for coming out tonight to learn a little bit about human trafficking. Like Sean said, I'm a forensic nurse at GBMC. So our SAFE program, I'm sure pretty much all of you are aware of that. We treat patients who have been victims of sexual assault, domestic violence, recently expanded a few years ago to child abuse, child sexual abuse. We treat human trafficking patients. So pretty much anyone that comes into the hospital who has suffered a violent crime. We do medical forensic exams, collect evidence to help with police prosecutions as well. Okay, and my contact information is on the screen. If you do have any questions or comments after tonight, please feel free to shoot me an email. So a few objectives. We are going to trafficking is discuss different risk factors, signs and symptoms that you might see with a human trafficking victim. We're going to kind of go through how someone gets involved with this, from how they're targeted, recruitment, grooming, and why they stay in the situation. We're going to talk about red flags that are common with victims, what you might see that might throw up a little red flag and may want you to investigate a little further. The role of everyone as first responders in caring for either suspected victims or a victim that discloses to you. And then once you identify a victim, you have to really know what to do. Do you report it to police? Do you not report it to police? So we'll be talking about that. And then also discussing some different resources to give out to your patients. So this is a quote that really hit me when kind of starting to develop my different trainings for human trafficking, because before I became a forensic nurse, I really had no idea what human trafficking was. And I thought it was something along the lines of that movie Taken, if anyone has seen that. So I thought it was, a young girl goes on vacation, she's kidnapped, it's forced drug abuse, physical restraints, and then she's sold to the highest bidder. When in fact, human trafficking, it can occur that way, but mainly it's not like that at all. So if we don't know human trafficking is a potential issue, we're not going to spot those red flags. Okay, so the importance of this training. First responders, usually the first ones on the scene, and then you play a unique and crucial role in being able to identify these patients. Sometimes our field as healthcare providers, we're the only ones to have any contact with these people when they're being trafficked. Many in our field don't believe that this is an issue. They don't have the adequate education about this, so they don't really think that it's going on in our community. And then due to that lack of awareness, many people will never be identified. So here's just some different stats from some studies. 88% of survivors reported having some type of contact with the healthcare system while being trafficked. A recent study just came out this year. 244 EMS personnel were surveyed, and less than half reported receiving training. Only 5% of ED personnel are trained to treat victims. and only 6% of healthcare workers report treating a victim of human trafficking at some point in their career. So there's definitely a gap in the education there. So in Baltimore County, we are doing many different things. The Baltimore County Human Trafficking Work Group, I was just accepted into that, and it's a group of healthcare, the school system, the legal system, kind of everyone getting together, and we're going to be formulating different recommendations for many different disciplines. So currently, as I was doing some research for this group, no hospital in Baltimore County has a current policy related to human trafficking. So that's another problem that we have identified. We have at GBMC drafted a policy waiting to get approvals, and then our plan is once that's approved and education's in place, we will share that with other hospitals. So everyone in Baltimore County will be on the same page. And you will have consistency with whatever hospital you take your patients to. So and then in the program, we've trained many different healthcare providers, nursing students, foster care parents, community members on the issues of human trafficking. All right, here's some different myths. These are some things that I believed before I really got into this subject. So human trafficking and smuggling are the same thing. They are not. Human trafficking is a crime against a person, and smuggling is a crime against a nation and its borders. Human trafficking involves movement of the victim across borders, and it does not. A person can be trafficked right in their own home without ever leaving. Another belief that I had was that it only happened overseas. It did not happen in the United States, and it definitely didn't happen in Maryland. I would never have a trafficking victim come into GBMC. And victims are held against their will using some sort of physical restraints. Though that is the case at times, mainly it's more of a psychological manipulation that keeps these people under control. Only females are victims. We have seen that young boys and men can become victimized as well. And if a victim initially consents, it is not considered human trafficking, which is false. So say, for instance, you have a woman that gets into prostitution voluntarily, and then she has a trafficker or a controlling person that comes into the picture. And he starts controlling her, taking her money, beating her. She is now a victim of human trafficking, and it doesn't matter that she originally consented. And then also, victims will reach out for help. If it was you or I, and we were being held against our will, and we saw a police officer or someone that might be able to help us, we would probably scream out and say, please help us. But most victims would not do that, and we're going to talk about that in a little bit. So what exactly is human trafficking? I'm not going to go through each of these definitions. They're very lengthy, but pretty much human trafficking is any time a controlling person uses force, fraud, or coercion to exploit another person. There's many different forms of human trafficking. For the purpose of this presentation, we're only going to be talking about sex trafficking, but just be aware that there's other types and try to educate yourselves about them so you might be able to spot those victims as well. There's labor trafficking, domestic servitude, there's organ trafficking, there's children soldiers, just many different types. Sex trafficking, in simplistic terms, is just when a controlling person uses force, fraud, or coercion to facilitate a commercial sex act. And a commercial sex act could be any kind of sexual act in exchange for money or something else of value. So that could be a person working at a strip club and they're being forced to do that. It could be pornography online. It could be a porn chat room or something like that. Or sex trafficking could be any time that someone is engaged in commercial sex acts and they're under the age of 18. And we're going to go through that in more detail in just a bit. So in order for it to be human trafficking, there has to be force, fraud, or coercion involved, and these are just some examples. Sometimes all three are involved with a particular case, sometimes just one. But in order for it to meet the standards to become human trafficking, at least one of these has to be involved. So sometimes it is like the story that I mentioned earlier about the movie, where it's restraint, confinement, sexual, physical abuse. They will deprive the victims of water and food and basic necessities, forced drug abuse, kidnapping, sleep deprivation. A big thing with the younger kids is promise of a better life. They target young, vulnerable kids and say, you have a terrible family, do anything you need. I'll give you love, I'll give you marriage, I will take care of you. Debt bondage is a term that describes, for instance, when a person meets another person and the person will help them with different things and say, you know, you can move in with me to help you through a bad situation. I will pay for your food. I'll pay for anything that you need. And then they say, actually, now you owe me all this money back. So that person is then forced to try to earn this money, and at the same time, they are constantly being charged more for, okay, well, now you lived with me for another week, so now you owe me more money. You talked back to me, you're gonna be fine, so you owe me more money. So that person who's being trafficked has this false sense of power that, you know, I'm in control of my situation. As soon as I work hard and make the money back, then I'll be able to get out of the situation. And then coercion would be threats of harm, threats against family, blackmail, abuse or threatened abuse of the legal system, and threatened deportation. Okay, let's see if we can get this to work. Okay, this is just a quick video I wanted to show you of a actual trafficking survivor.
Human trafficking. It's a terrifying and complex topic. It has many myths and misconceptions. But this modern day form of slavery doesn't just occur overseas.
Children are free tonight from the hands of sex traffickers in Springfield, Illinois. They were rescued as part of the FBI's sex trafficking program.
From the Metro East to St. Louis, Melissa ranks just this year.
St. Louis has been rated by the Department of Justice in the top 20 most human trafficking jurisdictions.
The lawyer who wrote this entire case says all of it's clearly a case of human trafficking.
My mom was involved with a man that not only supplied her drugs, but also offered to pay our rent and take care of our housing needs in exchange for sex with me. At 8 years old, I was trafficked for the first time.
According to the United Nations Global Initiative to Fight Human Trafficking, healthcare providers are well positioned to identify and assist trafficked individuals, as well as those who may be at risk but have not yet been actively exploited.
Anywhere from 20 to 50% of these victims will present to an emergency room, to a clinic, to a health clinic, seeking medical help. So obviously we have an opportunity to interface with these victims and not only give them medical care, but maybe try to help and save them and rescue them from this horrible situation.
After running away from home, Christine would spend almost 2 decades experiencing homelessness, drug addiction, and even fell unknowingly back into being trafficked. Throughout her adolescence and adulthood, Christine had multiple encounters with healthcare providers and recalls her own clinical manifestations.
I hit the emergency room for malnutrition like a dozen times. Nobody asked me why I was starving. You know, there are symptoms. Burn marks, because lots of times burn marks are used, burning is used as like a form of torture. So you're a commodity. When I did end up in the emergency room, my pimp was in with me. You know, some of the things that could have maybe been done is if they would have taken me into another room and insisted that that's what needed to be done. Maybe we need to do a urinalysis or something where they know they have me in a room that's not with that person.
If you're sensing something's up, something is up, explore it, get them apart. If they won't separate, that's a really bad sign. Again, we look for the high-risk complaints, you know, the sexually transmitted diseases, the mental illness complaints, the injury complaints, but truly any complaint could be. They can present with any complaint. But I really think it's the dynamic relationship which might really kind of tee you off.
Along with recognizing signs and symptoms and maintaining a safe environment, how the healthcare provider communicates is also crucial.
I think some of the better ways to ask questions could be, have you ever had sex for money? Have you ever had sex for a place to sleep? Has anybody forced you to have sex for money? Have you ever had to have sex for food, exchange sex for food? Because when we ask those questions, it really, you can follow body language and you can look at individuals and you can see.
As the years went by, with the help of social service organizations, Christine would eventually find the will to seek help and change her ways. Today, she's an author, community activist, a motivational speaker, and is even a proud mother of two.
You know, everybody has value and work. We're all part of the plan, and nobody has a right to objectify and commodify us as individuals for their own gain. Not the traffickers and the purchasers have no right. They have no rule over another human being to be the ones to objectify a human being for their own sexual gratification.
Okay, so that's pretty powerful video. It shows that this woman suffered years of abuse because no one knew what to look for and no one questioned, what are you doing here again? And if we just ask a simple question, we really could be saving someone's life. Okay. So some statistics, and the statistics on this subject are really shaky, only because it is really underground hidden crime. But there are an estimated 21 million victims of human trafficking worldwide. An estimated 200,000 people are trafficked within the United States each year. And human trafficking has been identified in all 50 states and DC. Human trafficking is the second highest grossing criminal enterprise, right under drugs. It's huge. It's actually above arms. And the reason that is because with drugs or arms, you can sell those one time, refill your supply, and then you have to sell them again, and it's a huge risk. With human trafficking, you can sell the same person over and over and over again, multiple times a day for years. The average age that is first targeted and exploited is between 12 and 14 years old. I mean, that's shocking to me. These traffickers will target these vulnerable kids in foster care systems or people where nobody's going to look for them. And it's estimated that half of all sex trafficking victims are minors. 50 to 90% of minor victims of trafficking have been involved in child welfare services as well. So human trafficking here in Maryland. Traffickers and victims have reported to police that it is a gold mine for human trafficking. So it's many different factors. 95 goes up to New York, down to Florida, across the country. A lot of different interstates here, which affects the number of human trafficking victims. The central location to all of those other cities. We have a lot of rest stops, truck stops, and bus stations. BWI is relatively inexpensive to fly in and out of. We have a lot of large conventions and sporting events, so when we have a lot of people coming into the city, the demand goes up. Gambling establishments, adjacent areas of poverty and wealth, and then just a general lack of awareness from everyone, the community, healthcare providers, so that definitely will affect. So here are a few different things that I found just with a Google search when I did this presentation last year. There's a lot of this going on all around us. In Baltimore County and other counties in the state, this happens all the time. And the majority of these news reports talk about teenage girls. And even an ex-corrections officer was charged with human trafficking. So really the trafficker really could be anyone. Okay, minor victims of sex trafficking, this is really important. So there's no such thing as a child prostitute. Anyone under the age of 18 who has any kind of involvement with commercial sex acts is considered a human trafficking victim. So that force, fraud, or coercion that we talked about with adults does not apply to children. It could be present, but it does not have to be present for it to be considered trafficking. And what's a little confusing is that the victims may or may not have a trafficker. So this minor could be voluntarily engaging in commercial sex, and she's considered a human trafficking victim. For example, a young girl self-posts ads online, exchanging sex for money, she's a victim. If a 17-year-old is working at a strip club, she's a victim of human trafficking. So the victims will exchange sex for anything of value. And it includes survival sex, which is just somebody exchanging sex to survive, for shelter, food, any necessity. So with adults, you always have a victim, a trafficker, and a buyer. And there's really no single profile for any of these groups. It can be any age, ethnicity, or sex, all socioeconomic backgrounds. It can happen in any community. This picture on the screen, I believe, was from Ohio, and the man on the left was a drug dealer to this woman, and she was exchanging her 11-year-old daughter in exchange, letting him have sex with her in exchange for drugs. This man was videotaping it, and she would reward her daughter with a little bit of heroin afterwards for good behavior. So it just shows that, you know, traffickers could be anybody. It could be a parent, you know, it could be a guardian, it could be a boyfriend, a girlfriend. So some risk factors for someone to be involved in human trafficking: young age, like I said, naive, vulnerable, poverty, you know, someone wants to make some quick money, drug or alcohol abuse, family dysfunction, homelessness, runaway is a huge risk factor, any kind of mental health problem, learning disability, emotional stress at home, lack of social supports. So these are the people that no one's really going to come looking for. Any involvement in the foster care system is a huge, huge risk factor. Any kind of desperation for emotional attention and love. History of prior physical, emotional, and sexual abuse is also a big, big risk factor. And the LGBTQ community. So the recruitment, this is how a trafficker will get access to this person. It can happen in many different ways. False job advertisements, where, say, someone applies for a job as a nanny here in the United States, they get here and then realize that there is no nanny job. They're going to be forced to have sex. Family arrangements, like the woman that we just talked about, the mother who was exchanging her daughter. Abductions, promises of love and marriage, promises of a better life, people pretending to be your friend. Internet advertisement, social media, Facebook is a huge platform to recruit young girls and boys. Online chat rooms, public places, happens in schools, happens at our malls. And use a slave to catch a slave is a phrase that means you will send out your current victim to go attract other victims. So it's not some creepy man standing around trying to get young girls in. You have, you know, an attractive younger girl who's cool, and they go out and bring victims back with them. So grooming a victim. For this, I like to think of domestic violence and child abuse. So usually with domestic violence and child abuse, that abuser is not going to abuse that person at the very first contact. You're going to groom that person. So human trafficking is pretty much the same way. They groom them in an effort to eventually control them. We have, with some of the research that's out there and some of the reports from police, sometimes people, the traffickers, will groom girls for 6 months and have an online relationship with them for 6 months. And they take that long to get that person to trust them and get them to think they love them, and then they have them. But they're doing this to 20 girls at the same time. So if one gets away, it's really not that big of a deal. Grooming can include flattery, buying gifts, giving affection, developing relationships, and this will make that victim believe that they love them. So here's a few human trafficking terms. These are terms that are really big in the human trafficking community. And I'm not expecting anyone to memorize all of these, but just kind of familiarize yourselves with them, because if you hear a patient saying any of these words, it might be a nice red flag that may make you want to look into the situation a little further. So a bottom, sorry? Sure.
If the victim's non-compliant, the state's going to be the reporting person, and they can't, and the victim cannot undo it.
Can you repeat that? I'm sorry, I didn't understand the question.
The victim, they have no ability to make the charge go away for the trafficking person. Is that correct?
We're going to talk about reporting in a little bit. Is that what you mean? Okay. I'm sorry, I don't really completely understand, but I think, are you talking about when you're reporting? Yeah. Okay, so we're going to talk about that near the end. Okay. Okay. So here's some other terms. So the bottom is one that I like to remember, because this is someone that is like the trafficker's right-hand girl. So she's still a victim, still under the trafficker's control, but it's his girl that looks after all the other girls and will report offenses to him. And wifey, wife-in-law, sister wife, these are what the victims will refer to each other as when they're under the control of the same trafficker. Out of pocket is a phrase that describes when the victim is disobeying any of the trafficker's rules. All right, so the big question is, why do these victims stay? So these victims can become somewhat brainwashed and may believe that this trafficker is the only one that cares about them, and that the trafficker is the only one that cares about them, and they would really never do anything to actually hurt them, and that, you know, they kind of got themselves into this situation and there's really nothing they can do about it. Stockholm Syndrome is a psychological phenomenon in which victims express empathy and positive feelings towards their abusers, and they'll even defend their abusers or identify with them. Trauma bonding, again, think domestic violence. It's a strong emotional attachment between an abused person and their abuser. Occurs as a result of the ongoing cycle of abuse with intermittent positive reinforcement, rewards, and it creates a powerful emotional bond. Other reasons that victims stay is out of fear. They're just terrified that they're going to be killed or that something terrible is going to happen to their families, especially if there's been threats against their families. They're isolated. They don't have access to any communication devices. They're really ashamed of what they've been doing, so they just don't think they can go home. Addiction issues, if they are hooked on something, that's their main concern. They don't want to go somewhere where they're not going to be able to get their drugs. They don't have any money, they don't have any identification or documents, or a fear of deportation. So this was from a court case a few years back. These are two human trafficking victims that were being trafficked by a father and son duo. They were both under the age of 18 when they began the exploitation. And this is the both of them in court defending their trafficker. So the traffickers are on trial, they're in custody, and they're still defending them. So it just shows that psychological bond that they have. So will a victim disclose? If you're having some red flags pop up and you ask a patient, you know, are you okay? Are you being forced to do something you don't want to do? Are they going to say, yes, please help me? Most likely not. And that can be because of the fear, loyalty. They are trained to not trust us. So they're trained to not trust us as healthcare providers. And they believe that they might be being monitored. So if you're having a conversation with them, they think they're being monitored or they are being monitored with a cell phone. We'll talk about that in a little bit. They don't identify as a victim. We recently had a few teenage girls come in that were being trafficked, and they had no idea that something bad was happening to them. They said, you know, my boyfriend takes care of me, he gets my nails done, I have nice bags, I'm being taken care of, my parents never took care of me. So they really thought that this was a positive thing in their life, even though they were being forced to have sex. Untrustworthy interpretation. If the trafficker is interpreting, you really have no idea what that person is saying to them. You're not able to speak privately with them. You know, poor provider knowledge. I think that's a big one. You know, the patient's not going to come to you and say, hey, I'm having this issue, please help me, unless you ask them. So if you don't really know there's an issue, you're not going to have that conversation with them. So the role of first responders. So again, you're usually the first ones on the scene. You have a really unique role with these patients, and you do have the opportunity to get them alone. So sometimes if you suspect something, you can try to get that patient alone in the back of an ambulance or take a walk with them and just get them away from that controlling person to try to have a private conversation. So your role is really to stay informed about this issue, educate others, develop policies and procedures, recognize the signs and symptoms to be able to identify these victims, provide physical, psychological care, give them some resources, and then we'll talk about that in a minute. So these are different causes for concern. So these are going to be the red flags you might see. So any kind of delay in seeking medical care, that's a really big red flag. If you go out and they had some issue that occurred 2 weeks ago and they're just calling, that's a big red flag. Any evidence of injuries inflicted injuries that look at like various stages of healing. If they have a scab and then an open wound, if they have 2 different color bruises, things like that. If they're telling you what happened and it really does not seem plausible to you, their story's inconsistent, they're changing it, very vague about what happened, they appear a lot younger than what they're telling you, they have no idea where they are. We had this recently where we had a 13-year-old in our ED and she had no idea what state she was in. So if you ask them where they are and they don't know, or they say, yeah, I grew up here, some questions that I like to ask is, okay, where'd you go to high school? Because if they are from the area, they would know the local high schools. If they're not, they won't. So that could be a nice way to find a red flag. Inappropriate attire. We have had patients come into the emergency room in lingerie, or saying that in lingerie in the middle of the night and saying they're vacationing. You know, those things are very suspicious. any kind of branding, which we're going to talk about in just a minute, and then any kind of undetected or untreated medical conditions. If they have something that you have found that has not been addressed and they have no idea they have it, that's also a red flag, because most of these people don't have access to regular medical care. So some behavioral red flags: another person is speaking on behalf of that patient. Another person is insistent on interpreting for that patient. That patient is with someone that just, it's obvious that they're being controlled by them. When you ask them something, it seems to be like it's rehearsed. The patient seems to have fear or anxiety when in front of another person. Any adolescent or child with a history of STIs is a big red flag. They're unable to use, or they have a fearful attachment of a cell phone. So sometimes the traffickers will make their victims check in every 20, 30 minutes. And if they don't check in, they're going to be beat when they get home. So if that person cannot let that cell phone go, that's a big red flag, even though most teenagers now won't let that cell phone go. Any large volume of hotel keys, condoms, or cash in their possession. So this is branding. Branding is a tattoo that signifies ownership over a victim. It's also a form of psychological control. Branding, it really can be anything. It could be the trafficker's name. It could be money bags, dollar signs, barcodes. Sometimes they're on the neck. They could be really anywhere on the body, but most of the time we see them on the neck, just where it's easily visible. And also in the inner lip. So when we do our exams at the hospital, we always do an oral exam and pull down the inner lip to look for any kind of tattoos there. So when our patients come to us, these are some of the normal presentations that they come in with. So vaginal bleeding, any kind of pregnancy complications, inflicted injuries like burns, contusions, strangulation injuries. They're suicidal, malnutrition or dehydration, any signs of sexual abuse, fatigue, maybe they're not being allowed to sleep, any vaginal or anal trauma, substance abuse issues, they come in for HIV testing or treatment, pelvic pain, stomach pain, dental complaints, traumatic alopecia, which is when someone forcefully pulls the hair out of your head. But what I think is probably more common than not is anything to do with vaginal bleeding, pregnancy complications, trauma. And I think that because if the trafficker is bringing someone in and allowing them to see a medical professional, they don't care that they have pelvic pain. They don't care they have a burn, because they probably were the one that burned them in the first place. They're going to care about the things that are getting that person off of the street and stopping work. So they're going to care if there's vaginal bleeding. They're going to say, I need my girl back to work, so we need to handle this. Or if there's a pregnancy complication, we need to get this straightened out so then we can get her back to work. All right, so treatment of the human trafficking patient. Obviously, safety is number one always. So you want to treat every single situation as extremely dangerous until you have some kind of understanding that it's not. You want to notify law enforcement for any kind of immediate threats, and then try to speak with the patient privately. Never try to talk to a suspected victim in the presence of anyone else. So even if it is a concerned best friend, have that person leave, because that could be the bottom. You don't know if that person is really listening and kind of preventing the victim from telling you what's going on. So assess that risk prior to making any decisions about interviewing. If you think that you're having this gut feeling that you might be putting them in danger, just don't even try to interview them. And then what we do at the hospital is we state that it is our policy at the hospital that we have to take this person alone to CT or alone for a urinalysis or whatever we have to say to get that person alone. Usually if you say this is our policy, we do it for everyone, they're not going to be very suspicious, and they're probably going to be more likely to let that person leave. Okay, so when we're interviewing, always get trustworthy interpreters. If that person, anyone interpret for them. You want to develop a report, remain non-judgmental. Some of the things that we have heard as forensic nurses, our jaws would drop. But if you show any kind of judgment on your face, that person will completely shut down and just end the interview. So just try to remain as non-judgmental as possible. Always ensure that safety and privacy during the interview. Do not ever allow any cell phones in the interview. Like, have them put them away, or have like one of your other staff members hold on to them, because that trafficker could be listening in, or that person may think they're listening in and they're not going to talk to you. Reassure that confidentiality will be protected if possible. We'll talk about that. Utilize open-ended questions. provide patient with options. They probably don't get any options in their normal day-to-day life, so just giving them some kind of option will help them feel empowered. Acknowledge their strengths, and then use a trauma-informed approach. So trauma-informed approach, just helping the victim build some sense of control and empowerment. It promotes the healing and recovery, and it involves understanding, recognizing, and responding to the effects of all types of trauma. So here's the question that I usually like to start out with, because sometimes it is uncomfortable to go to someone and say, hey, is somebody forcing you to have sex? You know, you don't want to really lead with that. So this is what I use. I ask all of my patients questions about violence, because we know that violence is common in our society. Is it safe to ask you some questions now? Giving them an option. I'm concerned about your safety and I would like to ask you some personal questions. Is it okay to ask you these? You do not need to answer anything that you don't want to. And here are some sample questions to ask. Things like, where are you right now? Where are you from? Where do you live? Who do you live with? What kind of work do you do? Are you free to come and go as you wish? Are you in control of your own money and documentation? Do you owe anyone money? Is anyone hurting you? Excuse me. Have you ever been forced to have sex or use drugs? Have you ever been threatened with violence? Has your family ever been threatened with violence? Do you have to ask permission to eat, sleep, or use the bathroom? Have you ever run away from home? Tell me about your tattoo if you see something that looks suspicious for branding. And then we went to a conference a few years back, and a trafficking survivor actually brought this up at a conference. Are you afraid to be out of pocket? So disobeying the trafficker's rules. And if you say that to someone, their reaction will tell you if they're familiar with that term. All right, so you're suspecting a trafficking victim, or you have had a clear disclosure. What do? Treat medically, assess mental health, assess for suicide. Everything you document in the patient's own words. We include suspected human trafficking in our charting, because if we include that, they don't want help right away. At least that can get transferred over maybe to the next time they come into the hospital. Patient education, tell them that what is happening to them is wrong. Help is available if they want it. Give them resources. You can refer for a forensic exam if appropriate. So we can do forensic exams up to 5 days post-assault. So if they have had sex with a John in the last 5 days, they can come in and have a forensic exam free of cost. Report suspected or known offenses, and report suspicions to hospital. So if you're transferring a patient to the hospital, definitely talk to the charge nurse, or talk to the physician, or talk to whoever you can, and explain your suspicions and explain why you're feeling this way. But don't assume that they're going to know what you're talking about, because unfortunately not everyone is educated on this. A lot of, even at GBMC, we have some people that really haven't had any education on it, and we're continually trying to educate. So if they're not really understanding what you're saying, see if you can talk to someone else, or maybe just give them a little 101 really quick. Okay, so reporting of minors. Are you mandated to report minor victims of human trafficking? Anyone say yes or no? How about yes? Are you required? What if you have a suspicion, but the patient is saying, I have no idea what you're talking about. I'm not being trafficked. I'm not being forced to do anything I want to do. Would you report that to police and DSS? What if the patient has no trafficker and they're just voluntarily engaging in commercial sex acts? They're having sex with another teenager for money. Yep, so in Maryland, human trafficking is the exact same as child abuse as far as mandated reporting. So trafficker involvement or voluntary actions have nothing to do with making a report. It really doesn't matter. And you report all known offenses and suspicions. So even if you have a little inkling, safe thing to do is just report it. You don't need to have proof. All right, so adults. Are you mandated to report adult victims of trafficking? How many say yes? Nobody. What if the adult discloses trafficking but says, please don't call the police? If you have a clear disclosure and they're saying, I'm being held against my will, I'm being forced to do these things, would you call the police? All right, so mandated reporting laws don't apply to adults unless they're a vulnerable adult. So even if you have a clear disclosure, this person is saying, I'm being beat every night and forced to have sex, you cannot call the police. Think domestic violence. If you go out to a call for domestic violence and the person is saying, he hit me last week, but I don't want police involved, we can't call the police. So adults have the right to make their own decisions regarding self-reporting. If they do want to report, call law enforcement. If they don't want to report, the best thing you can do is just try to throw as many resources at them as possible and just encourage them to report in the future. So what do you think some reasons are why we shouldn't report without consent? I have 3. So the first one, it would be a violation of the confidentiality. The second reason is, just like domestic violence, you really don't know how bad their situation is. And you reporting without their consent could make it worse. It could get them killed. You know, that person knows their situation best, and maybe they want to report, but just today isn't the day. Maybe tomorrow's the day, maybe next week. But you don't want to report without their consent because you really don't know what's going on. And the third one is, if you report without their consent, they're going to have zero trust for the healthcare field. So the next time they come in, they might not say anything to us. So as long as you keep that trust with them and say, please encourage them to report it, encourage them to get help, but it's ultimately their decision. All right, so the GBM Safe Program, again, we have 24/7 forensic nursing, 24/7 victim advocacy. We do the medical forensic exams like we talked about, medical care, collection of potential evidence, STI and HIV prophylaxis, and we connect them to victim resources. Here's the best number that you can jot down for human trafficking. This is a national hotline. It's open 24/7, 365 days a year. They also have a text line. They have 200 languages available, and this number can be called for anything related to human trafficking. Community members can call it, law enforcement can call it, healthcare providers can call it. They can assist with safety planning, shelter, mental health, case management, interpretation, food, transportation, legal assistance. I actually had called this number just to kind of see how it worked. Before I started passing it out, I wanted to see exactly. They were so helpful. They gave me a ton of resources in the community. I called them once. We had a patient at another hospital, and I just wanted to try to get some information for her because she was afraid to call. So they actually give you a case number that you can refer back to, or you can give that to your patient and say, look, I called this number. Here's your case number. You can, follow up in the future if you'd like to. So regardless of if they want to report, you can still call this number to make a tip. So you wouldn't give any identifying patient information, but you can at least give some demographic information about, even how old they were when they first became trafficked. If you know that information, kind of the situation of trafficking, how were they recruited, how are they being exploited, things like that. So this helps with the data. So you don't have consent. Just remember not to give any identifying information.
Even like approximate location, like what neighborhood they live in?
You could do that, yep.
But not a specific address?
Just not a specific address, no patient name, no birthday, nothing like that. Here's some other resources, the Suicide Prevention Lifeline. The Trevor Project is a great nonprofit that works with LGBTQ youth. They also have a chat line too. Immigration and Customs Enforcement, Department of Homeland Security, Polaris Project. But again, the National Human Trafficking Task Force, I think, is the best number for you to call. And they also have, let me go back to it. The number is very easy to remember, 888-3737-888. So what I would do with my patient, if they're an adult, they're not ready to report, I would read them this number and read it to them until they repeat it back to me. And then know, this is the number you call if you want help. Some local resources, here's a few. A full list of our local resources can be found on the Trafficking Task Force website, which is mdhumantrafficking.org. And again, with our program, if you are out in the field and you have some concerns, you can call a forensic nurse 24/7. So all you would do is just call the emergency department, ask to speak to the forensic nurse on call, and one of us will give you a call back. And at least if you need any assistance, if you're trying to get them into the hospital for treatment and they're being resistant, we can talk to them on the phone. We can talk you through certain issues. So we're always available for you. So I have a few examples just to kind of show that trafficking is never black and white. So a 15-year-old girl meets a 19-year-old man at the mall. He approaches her and tells her she's pretty. Soon begin a romantic relationship. He buys her gifts, compliments her, pays for her nails and hair, and tells her that he loves her. One day he tells her she needs to pay him back for what he has bought for her and asks her to have sex with another man for money. She says no. He's angry. He rapes and physically beats her. He says if she doesn't comply, he will kill her and her family. She agrees to his demands, and he posts an ad online advertising her for sex, and she's raped by 6 men in the same day. So it starts with the grooming. You know, he's telling her she's pretty. He's buying her gifts, complimenting her. And then she's in a kind of a form of debt bondage where he says, you need to pay me back. You owe me a debt. And then he's using force and coercion because he's threatening her family. Okay, a 23-year-old single mother is approached by a 35-year-old man while she is waiting for the bus. They run into each other 3 days in a row. They exchange phone numbers and begin talking daily. She is lonely and overwhelmed being a single parent. She is living with a friend but is being asked to move out. So she's pretty desperate. She forms a relationship with the man and he makes her feel safe. She moves in with him after knowing him for only 2 weeks. He begins babysitting for her while she's at work. So she's thinking, I've met my Prince Charming. I mean, she's kind of naive for letting a stranger babysit her child, but probably thinking, I met my Prince Charming. This is awesome. One day she comes home from work and her 6-month-old baby is gone. He tells the woman if she doesn't do what he says, his associates who are in possession of her son will kill him. She begins having sex with men in hotel rooms 6 days a week, and the man allows her to see her son once a week, and this happens for over a year. And all of these are true stories. And I'm a mother. I don't know how many people in here are parents, but if someone had your child, you would do anything to protect your child. And traffickers know that, and they will exploit that. A 32-year-old mother is struggling with a heroin addiction. This is about the news story that we looked at. She is out of money and unable to continue funding her addiction. She makes an agreement with her 40-year-old drug dealer in order to maintain her heroin supply. She allows her drug dealer to rape, sodomize, and physically abuse her 11-year-old daughter multiple times. He videotapes the sexual and physical abuse. She would tell her daughter that she was brave after he raped her, and then reward her daughter with giving her small amounts of heroin. It's sick. This happens everywhere. A 16-year-old LGBTQ boy runs away from home after coming out and not receiving support from his family. He is having trouble finding work and has been sleeping on the street and in a shelter when there's an extra bed. He meets other youth who are in similar situations. They introduce him to some men who will help him out. He begins to exchange sexual favors for food and a place to stay. So this is a form of survival sex. And this is human trafficking because he's only 16 years old. A 27-year-old Chinese national is offered a child care job in the United States. She leaves her family and travels to Baltimore. Her goal is to work in the United States and send money home to her family. When she arrives at BWI, she is met by a man and a woman who take her to a massage parlor. She is put in a bedroom with 5 other Chinese women who are all being held against their will. The man and the woman state if she does not do what they say, they will hurt her and her family in China. They also threaten to tell her family that she is a prostitute in the United States, which will bring great shame to her and her family, so she complies. The amount of massage parlors that are human trafficking rings is absurd. There's some right above the bail bondsman place in Towson. And they constantly use that bail bondsman place. They have a great relationship, apparently. All right, one more. A 13-year-old girl spends the majority of her time at home online. Her father is physically abusive to her and her mother. She meets another 13-year-old girl on Facebook who's in a similar situation. They communicate almost daily for 6 months. She encourages the girl to run away from home with her to live with her and her boyfriend. She runs away, meets the girl, and goes to the boyfriend's house. The man rapes her the same night and transports her to another city. The next day, she is forced to have sex with 3 men. She wants to go home but cannot escape the trafficker. All right, so take-home messages. Just human trafficking is out there. It happens everywhere in Baltimore County. It happens everywhere in the United States, everywhere in the world. As first responders, you play a vital role in identifying these victims. Report all known or suspected cases involving a minor, and do not report adult victims without consent, but do provide them with as many resources as you can and encourage them to seek help in the future. Okay. And again, my email address, if anyone does have any questions or concerns after tonight, please feel free to give me a call. Any questions? Yes.
Do any of these girls ever call the police once they're threatened? When they first discover something's wrong, do they ever?
I would say yes. So the question was, these girls, I'm sorry? Yes. So the question was, do these girls ever call the police when this is first starting, when they first are realizing something is wrong? And I think yes. I think every person, it's really case-by-case basis on how they're going to react to this. Some people probably do immediately say, this is not right, I'm going to get out of this situation. Sometimes the grooming has taken such an effect on them that they're really unable to escape. Yes?
How should prehospital providers report?
How should pre-hospital providers report? So I would say if it's a minor, call law enforcement. It would be the same mandated reporting guidelines as child abuse. So as mandated reporters, we are required to call police and make a report with DSS in the county that it happened. So when you're calling police, if it's a minor, you're calling police regardless of what the situation is. You're going to tell them on the phone, we have a suspected human trafficking patient. We need someone here immediately. So that's what we do at the hospital. So there's not a lag in someone coming to say this is a high priority, because you don't want that child running off, because usually they will run off and go back with their trafficker and try to escape the authorities. They're trained to distrust us. So I think just, calling 911, calling the police, however you contact police in your jobs, and saying, we have a suspected trafficking case. Can someone please get here immediately? For adults, I'd say the same thing. It probably wouldn't be as emergent with adults. I'd say with the kids, it would be more emergent. But we've had situations in the past. Actually, just recently, we had a 13-year-old trafficking patient who came in, but she didn't come in as a trafficking patient. She came in because she was found sleeping in an apartment building, and she was brought into the hospital for a safety check, like a wellness check. I just so happened to be there. I was doing something else, but they asked me to just come in and talk to her because the nurses in the pediatric department said they had some concerns. So I went to talk to her. She wanted nothing to do with me. So I just offered her, tried to make her comfortable, build a rapport. I offered her some food. She was really hungry. Offered her some water and just kind of let her take a nap. And with the report that I got was she was picked up, taken to the hospital. She had no idea where she was. She was a runaway. They ran her name. She was a runaway from Virginia from 2 months ago. And she had told either EMS or police that she was dropped off by a friend and they were going to be picking her up in a couple of hours at some apartment building. So obviously huge red flags. So when I talked to her, the only thing she was concerned about is where's my cell phone. That's all she wanted was where's my cell phone. So the officer who was with her, I said, I'm really suspecting human trafficking. So the officer talked to, chain of command, talked to her supervisor, and the supervisor said, I don't think it's that. So probably lack of awareness. But I was like, no, thank you. I called the CACU on my own, and I talked to the Child Against Children's unit and said, look, this is what we have. They sent a detective right over, and she disclosed to him that she was being trafficked. She ran away from home. She got picked up by somebody. She came up to Maryland, had no idea what state she was in, and she was being forced to have sex with men. Yes? I'm sorry, can you repeat that?
If we run into a situation where we're dealing with either a vulnerable adult or a vulnerable child, what is our responsibility to report to the receiving personnel?
What's your responsibility to report to the hospital?
Correct.
Okay, so the question was, if you have a vulnerable adult or a child, what is your responsibility to report to the hospital? I think that, try to talk to triage, try to talk to the physician and say, look, this is what's happening. This is what I saw. This is what the patient reported, and this has been reported because even if you're transferring them to the hospital, you're still mandated to make that report. Sometimes people fall through the cracks because if someone's getting transferred to the hospital, they say, okay, well, they'll make the report. But really, everyone that first comes into contact with that child should be making, or the vulnerable adult should be making the report to police. So I would say, just give them, go ahead.
Even if being an adult, they say, go report.
A vulnerable adult? So if it's a vulnerable adult, if they have any kind of cognitive deficits or anything like that, then it would be a mandated report. Just like any kind of abuse of a vulnerable adult would be mandated.
Well, I definition of vulnerable is below the gray side.
It is. So I'd say you just need to use your discretion. Yeah, because my idea of vulnerable might not be yours, So it really, if you think that they have a disability and you are, with talking to them, you believe that they are disabled or they have something cognitive going on, then I would say just to be on the safe side, report. Okay. With an adult who's not vulnerable, I would say the same thing. Go into even if they're denying, if you take them to the hospital, say, I think this person has been trafficked. This is why I think that, and and hopefully they will have a protocol in place to follow once that happens. Maybe they don't want to disclose to you, but they'll disclose to one of the nurses. So just keeping everyone aware and everyone kind of working together is a really good thing.
Like you said, we couldn't give any identifying, if they were an adult, we couldn't give specific identifying information.
You can't to police, but transferring medical care you can. You can't to police. But if you're transferring a patient, if you're picking up a patient and taking them to the hospital, you can discuss with the medical staff there. Yep, so that's not breaking any confidentiality. That's you as a medical provider expressing your concerns. Yes?
Are we required to transport to safe hospitals?
The question is, if we suspect this, are we required to transport to safe hospitals? That answer is no. I think it's best to respond to a safe hospital only because we do have nurses that are trained in these kinds of things. But any hospital, I mean, if you're transporting, I think if you can make it to a safe hospital, that's wonderful. If you can't, still, go through the same thing with reporting. They might actually want them transferred to a safe hospital. I guess it really just depends on the case. It's probably a case-by-case basis. If they want a forensic exam, they have to come to a safe hospital unless they're medically unstable, and the forensic nurses on our team will do travel cases. So if you get them to the closest hospital, they need a forensic exam, they are agreeing to a forensic exam, we can go to them if they're not able to come to us. Yes?
You were saying how, kind of going to deal with this question, how important it is to maintain the trust with the system. If they're not required and answering questions, the stuff you're seeing right now, if they wouldn't have to have a disability or anything like that, they're simply forced, and they're afraid.
Mm-hmm.
Is there some rule of thumb where you go against what they're willing to do?
So the question was that the person, like you're having a lot of suspicions, they are not really, like they're really afraid, something's going on, they're afraid, they don't want to report it, and he's asking if an adult, like is there any way to kind of get around that? Is that what you mean? Or you can report. So unfortunately, even if they don't realize they're being abused, that's why some of our roles is to educate them and say what is happening to you is wrong. But just like domestic violence, some of the victims of domestic violence don't really think anything's wrong. They just say, well, this is my fault that, he beats me because I do something wrong. So unfortunately, there's no way to get around that unless there's some kind of cognitive or they are considered a vulnerable adult. But like I said, if you're seeing all these signs, the best thing that you can do is just say, this is wrong, what's happening to you, we're here to help you, here's some resources, please try to report in the future. But unfortunately, if you, to remain or maintain confidentiality, you cannot report unless there's some kind of cognitive thing going on.
I have two questions for you.
Sure.
Number one is, how many patients have you or your team seen in the last year?
So I actually don't have the numbers on that. I actually had a meeting today to try to find out the numbers. We're going to start really tracking them. The problem with that is that we have not had a lot of education at GBMC yet. We're starting to roll out a whole education plan to educate the entire hospital, add some education to our annual competencies. So right now, I'm sure we're seeing a lot, but we're just not identifying them as probably a lot of other hospitals are. We do have human trafficking patients coming in. I couldn't really tell you the number because I'm not there for every one of them, and we haven't really been tracking them. But we have, personally, maybe like, for me, being on call, maybe 5. So it's pretty low. But these people, pretty much all the patients that have come into us have come in with police. They have not been identified in-house except for a few. This is just from my experience. Other forensic nurses might have a different view because we have 18 forensic nurses. We all take turns being on call. So there's been some that have been identified by the staff and said, we need a forensic nurse here, but the majority have been either brought in by the FBI or brought in by police.
Okay, so my second question was, how many of the victims would provided by the police, that would be obvious, but if their pimp brings them in, I would imagine they wouldn't let them go to the bathroom by themselves.
Yes. So, yes. So the question was, if a victim of human trafficking comes in, how many people actually get the exam? But the majority of our patients do have police with them currently. And the next part of her question was that if like a trafficker was with them, they're not going to let them come back for a medical exam or a forensic exam, which is, yes, that's pretty much the case. That's why we really try to get that person alone. We will call the police if we need to, if there's any kind of safety concern in our ED. We will get our security involved. We'll get other like key staff members involved if there's a concern. But sometimes if the trafficker is really pushing the issue of staying with that person, we don't push the issue back because it's just going to create a snowball effect.
You had this gut feeling that something is wrong, and the patient is an adult. Can you still call the police and say something's wrong here?
No. So the question was, if you have a gut feeling something's wrong and they're an adult, can you call the police and say something's wrong here? And the answer is no, unless you have some imminent safety concern. Where if you see, I walked into the room and that suspected trafficker has a gun on his belt, call the police. You know, things like that. Or if there's some kind of violence in the ED, call the police. But if it's everyone's acting semi-normal and you have this gut feeling and you know something's going on, you can't call the police without consent. Yes.
I have a question in relevance to a minor child, and one of the cases was the parent was the one involved. So many times we go on scene, we have a child, the parent could be involved in the hospital. They are in charge of the patient because it's their child is a minor. I guess in that situation, we would still call the police, just because we suspect something's going on. The police, their hands are tied. What happens at that point if we really suspect the child's being abused? I mean, can we call the National Human Trafficking Unit? Do we rely on the police to follow through with this? And just like your situation, you were talking about the police, they went to their supervisor, they're like, no, they don't want to do this.
So the question was, if you have a minor child who you go respond to a call about and you are having very, very strong suspicions that they're being abused and maybe the parent might be involved, what do you do at that point? Because the parent's going to say, I don't want my child going to the hospital. You call the police and really their hands are tied. So I think at that point, I mean, again, everything's case by case basis, but at that point, I would go above everyone. I would call the Crimes Against Children's Unit and whatever in Baltimore County and say, I am having a really hard time with this particular case and I need someone to come. Because you obviously don't want to leave if you think that child is being involved or if that child is being abused. And like I said, the lack of education, so just keep going up until you get the answer you want. You could even Crimes Against Children's Unit. Yep.
So if you have any question about a case like that and you want to contact them, you can call our forensic nurse on call.
And we could call them directly if needed. And that's a really touchy, I mean, it's a really terrible situation. I know it happens. Did I answer the question?
Yes.
Okay, you're welcome. Yes.
You keep saying somebody to call, so I put the hotline just on the phone number in my phone, but, you know, are we calling, you know, consulting with GBMC in order to get hold of you guys, or are we putting in our phones?
You can either call it really depends on the situation. If you just need, if you're having an issue with, do I report this or do I not? What do I do in this situation? I mean, you can really call either because they're both 24/7. I mean, we're available all the time. So if you have a question, we're always available to answer questions. The human trafficking hotline also, I guess it would depend on the patient. If you say, do you want me to call a forensic nurse to get more information? Or would you like this number to call? Yes.
Is the National Human Trafficking Resource Center a government agency or a private entity?
The Human Trafficking Resource Center, is it a government agency or a private entity? I believe it's a private entity. I believe it's a nonprofit.
So then it's not really, you don't meet the criteria of calling law enforcement.
Yes. Yep. So if you contact them, you can contact them anytime. If you don't get consent, you just can't give identifying information. Yeah, but you're legally allowed to call them. You're legally allowed to call them and just give basic information. Any other questions? And again, my email address up here, if anyone wants to jot that down, I'm always available if you do have any questions or concerns, comments.
Thanks, Ashley.
Thank you.